In Houston, I'm John Herder. It's Tuesday, the 30th day of April. Great as always to have you along, everybody. From the Experts is a virtual networking opportunity flow accelerator helping leaders across industries connect very briefly in a brief, moderated, interactive show format. It's like a TED Talk with interaction. And everything goes well, curiosity spark new ideas, accelerate action. You may have helped yourself or somebody else solve a problem, make a connection, reaching the opportunity faster. Folks, help me welcome guest expert Jayanth N Kolla. Jayanth is a seasoned technology expert with over 2 decades in telecom, internet, and emerging deep technologies. He's currently partner at Convergence Catalyst, advising companies on aligning with technology and market trends. He's a startup mentor and advisor to PE and VC firms. He holds 8 patents in AI/ML, advanced analytics, IoT, and robotics. He was instrumental in the growth and acquisition of an American health tech company by the world's largest health tech startup, where he led strategy and partnerships at Google Health AI. Welcome, Jayanth. So grateful to have you leading today's discussion, ways to think about protecting citizen data in the AI era and models that work. The potential of this seems massive if we get it right. So grateful to have you on board. Take it from here.
Thank you, John, and thank you everyone for joining in. I'm excited to discuss, this particular topic, having been a part of implementing one such model and one such framework. Today, over the next 10 to 12 minutes, I'd like to introduce our thought process from our previous project of how to look at data, citizens' data specifically in the upcoming, future AI world. And one model that we'd like to discuss, and then probably it will spark interactive discussion and or a debate. So I have about 4 slides that I would like to take you guys through to set the context, and then we can get into the discussion. So that's the topic. How should governments and companies think about citizens' data in the AI era? To start with, post the global financial crisis in 2008, in early 2010s, about a decade ago, it's starting with UK and then spreading across Europe. The open banking initiative was started in the banking and the financial services, primarily for the banks and the third parties and the technology providers to connect with each other and to seamlessly use the consumers' data to provide services. And this, over the last decade, and especially since 2018, 2019, grew rapidly. And on the other side of COVID, in England itself, about all the 9 banks got together and invested about 60 million pounds to build this technology infrastructure. And almost by 2021, 700 plus third-party service providers were involved, and 3 million consumers were being catered with this open banking initiative. Especially, essentially what it provided was, an API-based data transfer and interaction mechanism for the banks within themselves, within the financial services industry, and across various other industries. So open banking initiative envisioned a safe and a fully conscious cross-industry data sharing ecosystem. This is very important because this, lays or was the first foundational stone across any industry anywhere in the world for a robust data sharing ecosystem to be established. Over the years, almost every country around the world had implemented some or other form of open banking initiative, either regulation-led and or markets-led. Gus, next slide, please. In India, especially, the government, along with the private non-profit set of volunteers, developed something called as UPI, Universal Payments, initiative or infrastructure, wherein all the banks used. Just so you guys know, today in India, nobody carries cash. Monthly, about 12 billion transactions. Even micro transactions of a few cents going all the way up to a few dollars are being done using mobile phones, right? And the average is about 12 billion transactions a month. Okay. And the last was a volume of about $220 billion in a month of the transaction revenue, right? So this has been established as a digital public infrastructure, okay? And the India's Federal Bank, RBI, sort of came up with somewhere in 2021, they came up with this third-party player in the value chain called the account aggregator or business correspondent, whose entire job was to ensure that the data that was being transferred between the banks, okay, and all the third-party providers, it could be e-commerce players, it could be wealth management firms, or credit or personal finance management firms, anything need to be passed through this account aggregator. And the account aggregator's job was to ensure that the data transfer, okay, is anonymous and only the right parameters and metadata be transferred, okay, and the timestamp exists. And it was established, the account aggregator's job was to ensure that the consumer or the user's data and the ownership remains with the consumer, right? So 2-3 years ago, this new player called account aggregator came into the banking and financial services ecosystem and value chain in India, whose entire job was to ensure data privacy, security, and consent management. Essentially, the sanctity of data be maintained, right? And we've seen this being established in the banking industry. So we've used this, and when I say we, I'll talk about the team that that implemented this or established this this new concept, okay, or the new model, and what we did using that. So we use the account aggregator model that's been necessitated by the Indian Federal Bank to come up with, Gus, next slide, please, to come up with something called as a data fiduciary, right? What is a data fiduciary? Along with open banking initiatives, the open data policy or the open public data policy also existed for more than 10-15 years, since, I won't say the dawn of the internet era, but 10 years into the internet era, all the governments around the world, state, regional, and the sovereign governments started making the public data sets available for the private industry. But the problem with these data sets were they were siloed. They were mostly, the data was incomplete and corrupt, and it was not useful, or mostly it was not updated or readily available for innovation or using it for making any deriving any value out of it. Okay, so when we were working with one of the biggest public health projects, in fact population health projects, with one of the state governments in India, based on the account aggregator model, we came up with a model of data fiduciary. Now, data fiduciary is a neutral third-party entity whose entire job is to ensure that the ownership of the data remains with the citizen. Its job is to draw a balance between the sanctity of data, which is ensuring privacy, security, and consent management, while also making the data available in a masked, aggregated, and anonymized form for innovation, right? I mean, from academic institutions to research institutions to big tech companies to startups, they could use this data for AI innovation, right? And this was this model had been conceptualized to the level that it became a part of Tamil Nadu's data policy, which came out in March 2022. Okay, and the data fiduciary as a neutral third-party entity, okay, has been established for one of the biggest population health registry projects that we've done there. Okay, the entire idea was to ensure democratization of innovation of AI, while maintaining the sanctity of data, and the ownership of citizens' data remains with the citizen, along with the right consent management in place. So using this data fiduciary as a neutral third-party entity, we had done a, Gus, next slide, please. We have actually implemented one of the world's first and biggest population health registry, right? It's a government-funded program for population management and community health workers or field health workers who are networked longitudinally to deliver services across rural and urban areas, right? This was done in the southern Indian state of Tamil Nadu, and between July 2021 to Jan 2023, within a year and a half, we went ahead and screened 20 plus million unique population, with the number of those screenings being multiple screenings. So totally 42 million health screenings have been done. Each screening capturing about 55 parameters of health of the person, including family history, health history. And this data in an aggregated form was used by the government officials to see the heat map of communicable and non-communicable diseases, a real-time dashboard for them to optimize resources in terms of budgeting, in terms of medicines allocation, vaccines allocation. This was done on the ground by about 30,000, community health workers or frontline health workers, as we call it. Okay. And the government had a huge drug delivery program, a whole lot of drug delivery, lab tests, and even we'd also kickstarted a longitudinal health record maintenance of citizens and their data. Okay. With this project. This project grew from 0 to 20 million in about 1.5 years, along with working with government of Tamil Nadu, and now it's being taken to multiple states and within India and countries, especially in the global south, right? And while we were doing this is when we conceptualized the data fiduciary for health data, okay, and which the government liked to the extent that they made it a part of the data policy across various other sectors, okay. And now we have a neutral third party entity in the up and coming AI world, whose job and whose responsibility is towards the citizen and the consumer and the user to ensure that their data is used in the way that they would like it, right? So this data fiduciary model is, and the framework that we've implemented is something that I wanted to introduce to the audience and talk about and kickstart the discussion. During the discussion, we can talk about various other industries and use cases where this could be implemented. But I'd like to, stop talking now right here and take any questions if there are any.
So folks, what experience or questions do you have that you'd like to share with Jayanth? And Jayanth, when we think about this model, what's the golden rule, or what do you have to get right? That's one of the questions I have when creating this.
You mean while creating the data fiduciary?
Right. What do you have to get right? I mean, I imagine it's not going to be the same. Maybe it will someday across all nations, let alone corporations. But what do you have to get right?
You have to get. We had come up with with about 7 or 8 principles, for this data fiduciary that we call the first principles. We personally believe what you have to get right is the ownership of the data, remains with the citizen or the user. That is sacrosanct, and that cannot be moved away from. So whether the enterprises or the governments or the sovereigns, if as long as they adhere to that first principle, everything else can be built on that. The next would be choice. Apart from transparency, the next would be choice and consent.
Got it. So we've got a couple questions. Is this model, are you in any other place than India? Is it being used outside of India?
We are in advanced discussions with various countries such as Mauritius, Maldives, Indonesia, and Sri Lanka outside of India for this, for this model. Like I mentioned, most of the countries in the global south, not in any of the first world countries or the developed countries yet.
Right. And Rick, go ahead and ask your own question, would you?
So thanks for the introduction. Very interesting. I was wondering, do you know or are you aware of any other countries, for instance, in Europe, you were mentioning first world countries that are running similar models as this whole one data banking model was triggered by an action here in Europe? I'm not aware of anything, but I'm not too much in depth in what's going on, especially on the banking side of things. But are you aware of any countries that are running this as well?
No, in the developed countries, none of them are across industries. I mean, it is easier to start any of such digital technology play with banking because, banking industry has canonical structures in place, right? And healthcare, the industry that we work with, that too at the population scale, is on the other extreme. I mean, the canonical structures just don't exist. And to deal with data, and that too sensitive data. I mean, a citizen's health data is extremely sensitive. To deal with that and ensure its availability for a win-win situation, for real-time logging at an aggregate level. Okay, whereas creating a longitudinal health records for predictability of health ailments. Okay. Implementing this was on the other extreme in healthcare. But to your question, Rick, in Europe, there aren't any. For example, if you can look at what's happening in the AI world right now, right? Last month, Google and Reddit formed a partnership, and Reddit gave its users data, okay, for Google's LLM training. Now we can say that in the enterprises, the user knows because when he signs up, he signs the consent form. He knows that the enterprises can use it. But going forward, the question to ask is, would that impact the user behavior? I mean, right now, an average user still doesn't know that his data is being used or not being used. But let's say if it becomes a norm and a commonplace, okay, that his data is now being used. I mean, yesterday, Financial Times and had struck a licensing deal with OpenAI to provide all their articles and editorials and columns for OpenAI's LLM trainings, right? How will that impact user behavior going forward? That's a question that I think we as industry players and leaders need to think about.
Sure. And just out of curiosity, how do citizens, are they able to access their own data in the model that you're using?
Yes. So, there are a couple of tools such as DigiLockers and then consent management tools, okay, wherein the citizen can access it. Now, the entire consent management itself is a subject where it needs to be brought down to the citizen or the users, daily speak. We can't expect citizens to, to understand everything that's being written there, or even understand how and where their data is being used, right? So, for example, in our use case or in our project, our design team came along with our technology team, came up with a very simple design principle that the community health worker explains what the data is being surveyed and collected for and where it will be used for. So the voice during that explanation will be captured by the app. And if the in a colloquial language, in the language that an average citizen, this is rural India, mind you, right? So semi-literate citizen might understand. So we simplified the language to that level. And if the person, agrees, then they give a thumbs up, and that thumbs up with the person's face, the photo is captured, and that's consent for us. So a combination of a timestamp of the explanation of the consent or the need for data, and the computer vision, capture analysis of the thumbs up. A combination of this is consent that is being done by the technology platform at the backend, right? So we had to bring down the entire consent language simplified to the level for people's daily speak. So, that itself is a subject and will be a domain and a journey in different use cases and industries.
All right. I have a zillion other questions, but I want to make sure that the other people have an opportunity
Yeah, Rick,
to.
hang on a second. Let's a couple things. Rick, hang on to that. I'd like to go ahead and ask Karen to please introduce yourself, and then you put forward what you call a thought experiment, and then also want to make sure, Jayanth, that you feed in Dr. V in here and introduce him to let everybody know how he fits in. Karen?
Yes. Hello, everyone. Rick, if you want to go ahead, do you want to close out the snippet of conversation, or?
Sure. My final question was really towards GDPR. One of the major legal obstacles, if you want to call it an obstacle, it's a way to protect citizens, obviously, is GDPR. And what I've seen in the past years is that it's becoming increasingly difficult. I'm not even talking about companies like Google, because they're very advanced in their legal stuff, but like normal organizations here, there are families that are struggling, and there are 20 help organizations involved trying to get these families out of debt, trying to get these families healthy again, et cetera, et cetera. But all 20 instances are not allowed to talk to each other, and one of the obstacles there is GDPR. It's also sometimes an excuse. But is there something similar in India in terms of legal framework that protects your private data or personal data?
Yes, I mean, India's data policy is about to come up, but the same industry volunteer team that developed UPI, the public infrastructure for banking for us, the payments infrastructure, also came up with architecture called DAPA back in 2017. It stands for Data Empowerment and Protection Architecture, right? As soon as it was 2017 when GDPR was implemented. And when GDPR, when EU came up with GDPR, there have been multiple frameworks, across technology industries, consulting firms like Deloitte and IBM's and McKinsey's, and various countries themselves who came up with different, data protection architectures. But India's DAPA is, by far the most balanced in terms of ensuring that, the data privacy and security is maintained, but at the same time, the data is shared across, various players and layers, because there are multiple layers of consent involved in that. So India to a large extent uses DAPA, and I would like to draw a parallel of in the automotive industry, in the pollution norms, right? About 15-20 years ago, it was Europe that came up with different pollution norms, EU1, EU2, EU3. And then later, when the automotive players started, then India had its own norms called Bharat Standards 1, 2, 3, and it's 6 going on. Now, the automotive players who develop their cars and other vehicles, eventually the Bharat Standards became so overarching and all-encompassing that any automotive player, as long as he complies to BS standards, can launch his car anywhere in the world, including Europe. So we expect DAPA also to be the digital technologies and the data version of the BS standards that were driven or pioneered by EU first, but then something that India developed was most comprehensive and adopted by the global players.
Super. Thanks for that. Thanks, Karen.
No, for sure. And actually, my question or my comment piggybacks, which is, you can look at countries where GDPR doesn't apply yet in a form. And I think, a counterexample is Israel. So, you're going from 1.4 billion to, 10 million highly educated population. So we did some research there a few years ago. I work at Harvard Business School. I lead the case research and writing team there, do a fair bit of work on healthcare. So it's great to be here. And, the Israelis have basically 4 HMOs. And when you're born, you basically will go into one of them, usually with the families. And so these are actually organizations that have data from cradle to grave. So that's number one. Number two, the residents of Israel are very health conscious and very willing to get frequent blood tests and also get genetic testing given the challenges of the population. So the amount of data is not only has perfect sort of longevity, but also a type of breadth that we don't see. And a few years ago, we did research on Maccabi Tech, which is one of these HMOs. And the conversation there came up with a little bit, which is what you're saying, which is the leader of their data collection group was saying that when a drug gets developed, based on the data that comes from consumers, they should have a fraction of the benefits of that role. So they're kind of at the very extreme. So Maccabi Tech, I'll put the name of the individual who leads this in the chat. I think it might be of interest. The second area that came up when you talked was, and in terms of regulation also, is the HIPAA regulations in the US, which are, around data. So there are 20,000 mental health apps. A lot of them we think contravene, but actually they're third-party apps. So they can go around these protection restrictions by contracting to the hospital so that the hospital is not in violation of HIPAA, but they can sort of, so there's a one. And then the third one is the one that I put in the chat, which is, if I sign a data use agreement to an app that is then bought and rolled up by hospital system, should I be given a chance to say, we need to start anew, this will be the new rules of the game? So I think it's a fascinating intersection of sort of law, morals, and also much better outcomes. So as the Israelis tell you, is that they have done exactly what you said, which is they're able to see patterns. So they've changed, for example, colonoscopy testing, because they were seeing patterns that we weren't able to see in our fragmented healthcare system. So I'll stop there, but it's a wonderful conversation. Thank you for joining us today.
Jayanth, any feedback on any of that?
No, I mean, it was learning for me, and definitely I think we need to look at Israel and how those guys are implementing it, to have some learnings. This was very interesting. Thanks, Karen. Maccabi Tech.
Thanks for putting that in there, Karen. The answer is yes. I want to be notified if the agreement's changing and somebody's getting access to my data.
Yeah.
Absolutely. But how could I actually understand what it means? And I think maybe that's a great use for AI and smart models to protect privacy. Any experience there on how that could be done?
From our experience, I believe, John, that's an entire journey unto itself. Like I was telling earlier, the entire consent, we can't expect an average user to understand the entire consent speak, right? So bringing it down to the user's daily speak is a big design thinking and a design philosophy exercise and journey unto itself. And it would be different across sectors, use cases, and regions, I would imagine. I gave you one example of how we tackle that for a semi-literate rural Indian citizen. But if we were doing it for somebody else, it would be different.
Got it. So I just put in the chat, I mean, for you folks in different businesses, how are you actually organizing and balancing this data collection, for innovation with privacy protection? And, any particular thoughts that you're having around your own design based on what you've heard today, or practical models? Robert, you got anything in that area, or Tom or Thomas?
So what we do is and we're just beginning to do this, but we collect data on television programming, right?
Right.
So when you go on to TV, you see your commercials and all that stuff, but what people don't understand, especially on OTT and CTV models, there's a lot of information that goes along to find the right commercial for you. What content you're watching, where do you live, the demographics, all the stuff that goes along with that. And we have to be very, very careful because it's so visible. People will complain and get upset right away if, it's the whole thing on Facebook. If you go to Amazon and look up, double boilers or something, all of a sudden you start getting all of your commercials that are about that. So we specifically have worked on, and our algorithms are based all around privacy and opting in and opting out. And then on top of that, we allow people to say what they do want to see and what they don't want to see in the way of television commercials. And the biggest issue for us right now is keeping the privacy. We have to keep it inside the United States unless we're in Europe, and at that point we have to have it in a European country and not put the data out there. But that's what we're working on, and we're probably overly cautious about it because people will recognize right away whether we have their data or not based on the commercials that we give them. So that's what we're doing to that, and it's the number one thing for us is to say, and hey, listen, you can opt in and opt out of the service.
Right.
And also the other part about that is we can know what type of services and products you might like by what content you watch on television.
Right.
And that's a really interesting, that's our AI portion. And we've got a gal that's working on the AI portion of that says, if you, over a period of time with the number of samples, we can tell exactly the type of car that you might want to watch. And it's kind of weird how accurate this stuff is when you get the data all together.
Yeah.
Please, Giant.
Thomas, I have a question for you there. So right now, you guys are putting in the policies of opting in and opting out as far as your consumers and users are concerned. But as a company, as an entity, would you be open to a neutral industry-wide entity whose job is to ensure this opt-in, opt-out, whereas and your peers and your competitors would also sign up and get access to the consent management through that entity, number one. At the same time, if the entity makes the data also in a masked, anonymized, and aggregated way available for you guys to get patterns, derive inferences, and insights that are useful for your business.
Yeah, that's been a topic of discussion in a whole bunch of the television advertising and actually content and examples. Everybody wants to know, everyone wants to get data to know who you are.
Right.
We want to know who you are. We want to know where you live, what you like, what you do for a living, how many kids are in your house, all that stuff, because then I can target a commercial for that. But it can become, and the word that we hear most often, because we had this discussion the other day, is creepy. And we get down to the point that you have to be really, really careful about that. So each individual entity, that either the ad aggregators or the ad agencies or the people like the Philo, Crackle, CBS and stuff, they all keep their own data and they sell that data to different parties right now. And it's all anonymized to an extent. But if you're going to keep information, like if I'm able to gather information about you and I have to keep it in my own realm, because if I sell that information that's not anonymized, then you can get in a lot of trouble. And like I said, with television and things like that, people love to sue and say, oh my God, you know that I happen to like red zingers or something, and so I don't want everyone in the whole world to know that. So I don't know if there's an opportunity. I know that there have been people in both the IAB and MRC that have tried to put together that kind of stuff, but so far I don't believe anyone has been successful. And the other part of it, there's so many companies now that are wanting to gather data and sell that data to others, and they want to have differentiation. So it would be great if there was a central, repository for that, but I'm just not sure it's going to happen.
Right. And that's exactly what we are advocating. I mean, to establishment of a central neutral entity that we call data fiduciary.
Right. Robert, what's your take from the product strategy world and what you do?
So, I mean, what I do day to day in my role with the company I'm with, we're collecting data, but it's being used inside the organization. It's making sense of information coming in that's not already structured and turning it into usable. So it's not touching. If there was AI involved, it would be an internal AI model working, but no touches outside the enterprise. I mean, it would be firewalled to, if it could go outside and do something, would not be allowed based on the industries we serve. So it's a little bit more about collecting what is necessary to process than looking into the future or analyzing things, although the client would take what we've captured in time and look for patterns, trends in their business relative to their customers or constituents. So we're a little bit of an anomaly because we were working with government. You're not doing something for them in our world, at least. But one quick comment that I find interesting, and I'm definitely not got the background as Karen, as she explained Israel and just the whole health information and being HMO, assigned to an HMO, and then your whole health record being known for your life. But it sounds like here in America, we're primitive, and we are when it comes to the sharing of medical records, electronic medical records, and all that. But it sounds like, based on the example with what India did, right, with the medical information and looking for trends in infectious disease management, maybe, and all this, it's kind of like we have the real peripheral of that when you looked at COVID and flu season. I've got medical people in my family, and they're always constantly collecting numbers of how much a certain area of the country, a state, or a city, how much influenza is there, per se. And so they always know the percentages, and they can start to trend on where that will be heading. Like with COVID, they knew where trends and where the spikes were going to come in certain areas, so they could manage it differently. But the difference there was, if whatever it was, the CDC collecting information from your healthcare provider, if you got tests, it was just an outbound. It wasn't an inbound. So I couldn't look at myself other than in my own medical record. It was really very myopic, whether I did something, whether it fed up, but it kind of very still disconnected. But to me, that's like the very primitive way of starting something that here in the States, we are just way, way behind, or just not able to get through standards with medical record systems and the sharing of information, to having something more interactive as it goes to medical information and AI here in the States. That's just my 2 cents.
Right.
Just curious,
Yeah.
Dr. B, what's your take on that? And Giant, would you introduce Dr. B briefly?
I was just going to do that. So, folks, I'd like to introduce Dr. Viduthalai Berumbi. We can call him Dr. V. He is the former Senior Director of Ministry of Health at the state of Tamil Nadu. This population health registry project that we've implemented is actually his brainchild. He's been, sleeping, breathing, eating it for the last 10 years when we all came together in 2021 and implemented. And he being a doctor, especially in the public health space, has studied a lot of models, including the US one that you just spoke about. And I'd like for him to share some of his thoughts and his observations of the differences in the healthcare systems around the world, to what you just spoke about, Robert. Dr. Viduthalai.
Yeah, hi everyone. I'm hearing the conversation on the concern, like it's data privacy protection, how the data will exchange. So I wish to tell about the journey of how we solve this in an Indian setting. It starts with government to pass an announcement in the assembly. It starts there. It starts from the government, and each and every stage, the layer, the use of exchanging or using the data has to be spelled out clearly. I'm not entering into the concern yet. You can understand that at large, the government want to announce that this is happening. Then the people who are going to use it want to get authorized in public and private sector. Then the layer of exchange or interaction will come, where the patient and the service provider will update their records, or they will exchange some information there. In our learning, the take are different. Like the patients are not concerned about their data, medical data. The hospitals are not concerned about continuing the record or storage of the record for longer period. So the government has came up with a different data policy, data fiduciary. By practicing that, we learn all these steps. Like it's mainly evolving by practicing these law, where as and when we collect the data, like screening data, the quite example of COVID is also discussed in this forum. So that When it comes to an infectious disease or a pandemic like COVID, the law is entirely different because we share the personal identifier to the field response units who will go to door. So the exchange varies in general at 3 scenarios. One at pandemic or outbreaks kind of situation. And second, at very basic of leave the health, there is a socio-demographic, economic and geographical profile of individuals. So that profile is common for multiple departments. For example, if you want to know how many people are having a hut instead of a concrete house, so that is common between departments to provide the welfare service. When it comes to insurance, you want to know who is who. The maturity is not much, but one of the person will authorize that he or she is entitled for so and so dollars of insurance payback. So the responsibility changes here. If you see the pandemic, the responsibility changes. If you see the routine system, this changes. And especially the concern when we give to an individual, they are not in the position to operate it, or they are not using the system, managing their concerns. That's not happening in the real field scenario. So we felt that this data fiduciary is an entity which you yourself imagine there are 3 keys: users, provider, and there is one more person who is sitting as a governing entity, that is a fiduciary. Is only managing a principle. They cannot go and decide each and every transaction. So in general, the most of the we use the word follow up of individuals, replenishing the supply chains, the disease monitoring, the clustering. So you can able to see a encapsulation at different levels. You can put multiple circles. The circles are overlapping. The circles are coming with responsibility. So one set of people can look on the clusters of fever. One set of people will look on lab data, which is being used from private labs, that is coming to HMO kind of entities in India. The same will happen. The CT scan taken in government setting will go to a private facility through a health interface, which is available at the federal level. So this happened over time. So what we contribute is whether it is practiced, abiding, or complying with all the law in practice. That is what the fiduciary helps in one of the Indian state with 80 million population, where tech solves most of the problem at scale. It cannot be solved because think about 80 million people giving a paper-based consent, maintaining the consent, how to access it, all the issue when we are adopting such privacy law. So there comes the foundation thing is the foundational layer has to be tech. That foundation layer has to be managed and governed by a set of principles with the autonomous entity. In our experience, being a government as a data fiduciary, there is advantage as well as there are disadvantages. When a private entity asks for a data, it is not easily flowing there, but with set of process, it is being exchanged there. When it comes to a research, yes, it is openly shared. When we are asking for consent, only when there is interaction, the consent are actually exchanged. So when we put like 1 million consent towards the citizens, most of the people will see only when they get a chance. So we brought a facilitated process there. So there, the community health worker will play a vital role of translating this to a common citizen. Even we tried the participatory surveillance in other settings where the individual user will take most of the responsibility. In Indian setting, it is mostly a facilitated person. That facilitated individual want to build the trust between both the parties. like hospitals as well as the individual citizen. So this new entity helped us in translating this concern and whatever we are speaking as a privacy thing. When it comes to emergency, the role entirely changes because people are worried about the lives. So then the concern, whatever the access required, will work differentially. We actually call it as a differential privacy policy. You are aware that the differentiality between the individual, the doctor, and the hospital varies to each other based on the scenarios. So there is no fixed rule like only this will happen after signing 1, 2, 3 kind of thing. So overall, the experience is practicing solve many of this problem. Exchanging with private sector is happening through following a tech protocols as well as institutionalizing certain services. Only when services are exchanged, this implementation of privacy law becomes more easy for us. I stop here.
Thank you, Dr. Brumby. Jayanth, any last comments? We've kind of run a little bit over time, but well worth it.
Nothing. I mean, so I'd like to leave a thought experiment, for the audience. And Thomas talked about it, about the TV and the media industry. I'd like to give an example or a thought experiment of the automotive industry. Today, everything is a data creating entity, right? Your cars, your automotives as well. Cars full of sensors, okay, generate a lot of data, including the driving styles, and some of the automotive players or the service providers sell that data to insurance companies, and then different people get different insurance policies and premiums, right? Products and premiums. So today, the way enterprises have agreements when it comes to data sharing agreements, they are direct, and there's no neutral third party involved. In this particular scenario, let's say, John, you are a certain type of a driver, and let's say I'm a very rash driver. Okay, basis purely the sensor data that my car captures, my insurance premium will be high. But why should it be if I'm not causing any more accidents than you are, right? In this particular scenario, who's protecting me, and why is my driving style attracting a bigger premium, right? So in such a scenario, a data fiduciary whose job is to ensure that my data is protected and at least consented by me before being shared, is a good entity to have. And that's what we are advocating, that in the up and coming AI world, I think this neutral third party entity whose job is to ensure and be transparent towards the users and their rights, and the citizens and their rights, needs to exist. Okay, Thomas mentioned that in their industry it's already happening, and we see this happening across industries, enterprises sharing data. So this I'd like to leave with the audience as a thought experiment, and advocate a data fiduciary led model across industries and regions.
Thanks for that, Jayanth. Folks, how was the discussion today? Please go ahead and take a few minutes and complete the survey that's on your screen. And don't forget, later today, or maybe tomorrow for you folks in India, you're going to get the post show notes. Next up on From the Experts, May 21st, Stephen E. Luke. He's VP of AI and Governance at IBM. He's going to help you navigate some of the complex landscape that you're facing around AI governance, the hype versus reality, as he puts it. He's going to share the simple view that he's laid out of AI governance baselines and how it can help you accelerate AI into your business. So be sure and check out the expert library and upcoming shows on our website, fte.network. And while you're there, subscribe to our YouTube, Apple, and Spotify channels. Never miss a show. With over 3,000 members, 20,000 followers, and more than 45 industries, FT is growing fast thanks to supporters like you. Thank you. Folks, we're out of time. Once again, Jayanth and Dr. V, thank you very much. And to all of you from the experts, take care. We'll see you next time.